It's just wonderful to have you here today, and thank you for taking the time and taking the opportunity to be with us. Today, we will have Dr. Bauer's didactics, an amazing as developmental pediatrician and autism expert.
What I want to talk about today and really talk together about is, what we've seen with kids over the course of the pandemic and how we as providers can be supportive. So, I'm going to be speaking to this from a medical perspective, but I'm really interested to hear what you have to say as educators, as family advocates, as therapists and researchers, kind of what you're seeing and how we can learn together.
The reason why actually we decided to create this model and create this hub in North Macedonia, we wanted to ask our audience, how can we be of most service to you? The current trend in our country, and it has been happening for a really long time, it's becoming better now. I'm talking about North Macedonia, as a lot of times these cases are not even disclosed, and these children have never been diagnosed as being autistic in the first place. So if it's not coming from the parents, you have no way of knowing. They have not been even medically assessed. And then they come to a school, they're enrolled. The school maybe they always test them, but there are no obvious signs in milder cases, and all of a sudden there's an outburst. So with the pandemic, I think all of this has been really amplified, and we really need to think on a wider scale how to really improve the entire process.
It's very difficult to sort of get a grip of everything, and teachers not being trained to work with kids who are on the autism spectrum. Not having access, let's say, as a private school, not having access to any teaching assistants, for instance. That's why I wanted to basically see what I can take away from this and actually communicate with all of you to see what we can do and how we can help these kids. Because at the end of the day, this is our job, to help our kids. And this is what I really want. Perhaps some symptoms, if we can have a list of some symptoms or something, yes, so that we know how to diagnose it. We don't even know whether it's autism or not.
Especially for me as clinician, I'm interested how diagnosis is made in the USA and about the treatment. What kind of medication you're using when you have behavioral problems?
How do you then target support? Because what I'm hearing is really thinking about when families are there's not a diagnosis, or if they're not disclosing a diagnosis, then as a teacher, as a therapist, how do you best support that child? And also your teacher, also your team, right? Like, because that's an incredibly stressful for your team. And I think the other thing I'm hearing from a lot of you is that you wear so many hats, and Mary's taught me that too, is that like, she's not just a speech therapist, but she's also a behavior therapist, and she's also an occupational therapist. And then sometimes she feels like she needs to be a developmental pediatrician. So I think that, like, I'm also thinking that you guys wear so many hats. Yeah. And then how do you do that in a way that doesn't completely deplete you?
For the practice part, then, the telepractice, for instance, how to do it, or what kind of platforms are available even for clinicians, or what kind of training can be provided, because all of a sudden we are caught in this pandemic, right? It's just so difficult for us to deal with, even for college students that I'm teaching,
Are there ways of training the parents or caregivers to help do a diagnosis of co-occurring conditions? Can you come up with a checklist and things that the caregivers can do, because they have a lot more time and they're not constrained by that 45 minutes or an hour?
A couple things I think about. I think you're absolutely right, Spiro, that I think you have to partner with parents and families to really think about what's going on. And so I think that I have that conversation a lot with families. I believe strongly that every child deserves the same evaluation and they deserve a 360-degree evaluation. Those evaluations take time. Mary will be in touch with you about the next step, but we'd love for you to be part of this.
Yes, yes.
Thank you.
Wonderful. Thank you all and see you all soon. Next, it will fly by. A month will
Oh, yes, definitely.